General medical conditions, common infectious diseases, respiratory conditions. Sinusitis. The etiology stems from an upper respiratory infection caused by a variety of bacteria. Signs and symptoms include nasal mucous membranes that swell and block the ostium of the paranasal sinuses. Painful pressure occurs from the accumulation of mucus in the sinus cavity. The skin over the sinus may be swollen and even painful to the touch. Headache, malaise, and purulent nasal discharge are common. The management for sinusitis. If the infection is purulent, antibiotics may be warranted. Steam inhalation and other nasal topical sprays can produce vasoconstriction and drainage. Seasonal atopic or allergic rhinitis. This is commonly known as hay fever that results from airborne pollens. This is a reaction to pollen, dust, dander, or mold. Airborne fungal spores, also known as allergens, can be a trigger. Allergic antibodies cause the release of histamine. Signs and symptoms of seasonal atopic allergic rhinitis include eyes, throat, mouth, and nose that begin to itch, followed by watering eyes, sneezing, and a clear, watery nasal discharge. A sinus-type headache is common. Emotional irritability, difficulty sleeping, red and swollen eyes, swollen nasal mucous membranes, and wheezing cough are common. The management is oral antihistamines and decongestants. The diagnosis of allergic rhinitis is largely based upon clinical history and a physical exam. However, when patients do not improve with the over-the-counter medication, the diagnosis is uncertain, or the allergic trigger needs to be identified for targeted environmental mitigation. Allergy testing is then recommended. Specific allergy testing, a blood sample or skin prick, helps to aid in the diagnosis of allergies. The diagnosis of allergic rhinitis accounts for the timing, frequency or duration, and the symptom severity. Classifying the disease is important to guide its management. Acute bronchitis. The etiology is an infectious winter disease that follows the common cold or viral infection. Fatigue, malnutrition, or becoming chilled could be predisposing factors. Common signs and symptoms include upper respiratory infection, nasal inflammation and profuse discharge, a slight fever, sore throat, and back and muscle pains. Yellow mucus indicates an infection. The fever will typically last 3 to 5 days, while a cough can last 2 to 3 weeks. Pneumonia can complicate this condition. The management for acute bronchitis: avoid sleeping in cold environments and avoid exercise in extreme cold without protection. Rest until a fever subsides. Drink 3 to 4 quarts of water daily and ingest antipyretic analgesics, cough suppressants, and antibiotics. Pneumonia. The etiology is an infection of the alveoli and the bronchioles from a viral, bacterial, or fungal microorganism. It can also occur from irritation from chemicals or aspiration of vomitus. The alveoli fill with exudate, inflammatory cells, and fibrin. The signs and symptoms: bacteria will cause a rapid onset, high fever, chills, pain on inspiration, decreased breath sounds, bronchi on auscultation, and coughing of purulent yellow sputum. Viral pneumonia will go on for several days and up to a few weeks before becoming symptomatic. Patients will have a low-grade fever, muscle aches, fatigue, and coughing. Certain types of fungus can also cause pneumonia. When fungus is inhaled, some individuals will develop acute pneumonia. Others will experience a form that develops slowly and lasts for months. Few symptoms may be experienced. The treatment for pneumonia. We treat pneumonia with antibiotics and perform deep breathing exercises to remove the sputum through heavy coughing. Analgesics and antipyretics may be useful for controlling pain and fever. Asthma. The etiology and the exact cause is unclear. Metabolic acidosis, post-exertional hypocapnia, Stimulation of tracheal receptors, adrenal abnormalities, and psychological factors have all been suggested as the cause. Asthma can be triggered by viral respiratory tract infections, emotional upset, changes in barometric pressure or temperature, exercise, inhalation of noxious odors, or exposure to specific allergens. There is also a condition called exercise-induced asthma. This is bronchial asthma that's triggered by exercise. This is brought on by exercise with an exact cause that's unknown. The attack is triggered by the loss of heat and water and sinusitis. The signs and symptoms associated with asthma include spasm of the smooth bronchial musculature, edema, and inflammation of the mucous membranes. Individuals will have difficulty in breathing, and it may cause hyperventilation, resulting in a feeling of dizziness, coughing, wheezing, shortness of breath, and fatigue. Tight chest, breathlessness, nausea, hypertension, fatigue, headache, and redness of skin can also occur. If asthma is associated with exercise, it will typically occur in the first 5 to 8 minutes of exercise. Patients with a chronic inflammatory condition may have constant bronchi or bronchiole dilation. The management of asthma, regular exercise, and appropriate warm-ups and cool-downs are necessary. Using a mask or a scarf may be beneficial in avoiding cold, dry air. Conditioning tends to reduce the bouts of asthma in athletes. The duration of exercise should be increased slowly. Avoid exercising in high levels of pollution or high pollen counts. Inhaled bronchodilators may be helpful. Athletes must be sure that the medication they are using is legal for their competition, so it's important to consult with an athletic trainer or a physician to make sure. Cystic fibrosis. The etiology is a genetic disorder that can manifest as obstructive pulmonary disease, pancreatic deficiency, urogenital dysfunction, and increased electrolytes and sweat. Cystic fibrosis causes severe lung disease with a life expectancy of about 30 years. The signs and symptoms include bronchitis, pneumonia, respiratory failure, gallbladder disease, pancreatitis, diabetes, and nutritional deficiencies. They produce high amounts of mucus and they are susceptible to heat illness. The management for cystic fibrosis includes drug therapy to slow the progression of the disease, antibiotics to control pulmonary disease, consistent postural drainage to mobilize the secretions in the lungs, and high fluid intake to thin secretions and the use of a humidifier.